Understanding and overcoming emetophobia. Hi, I'm Dr. Tony Weston. Today we're diving into a phobia that often goes unnoticed but can severely impact daily life. Emetophobia, or the intense fear of vomiting. This fear isn't just about the act itself, it often extends to anything related, feeling nauseous, seeing someone else vomit, or even certain foods and environments that trigger these fears. Let's explore the origins, effects, and ways to overcome this often misunderstood condition. Emetophobia usually begins in childhood or adolescence, often rooted in traumatic experiences. These could be direct, like a particularly distressing vomiting episode, or indirect, such as witnessing someone else vomiting or hearing about a severe illness. Psychologically, emetophobia can be linked to control issues. For many, vomiting is seen as a loss of control, something that happens unpredictably and feels overwhelmingly out of one's hands. This creates a deep-seated fear, often compounded by anxiety and obsessive behaviours, designed to avoid potential triggers. Emotionally, emetophobia can stem from an inability to process normal human emotions, often linked to complex trauma or attachment issues from childhood. If a child grows up in an environment where emotions aren't validated, where they're ignored, minimised or punished, they may internalise their feelings, leading to heightened anxiety and fears manifesting in unexpected ways, such as emetophobia. The impacts of emetophobia are profound. It can lead to avoidance behaviours that severely limit one's quality of life. You might avoid certain foods, social situations, travel, or any environment that feels risky. This constant state of hypervigilance not only fuels anxiety, but can also lead to social isolation, depression, and a diminished ability to enjoy life. From a psychological standpoint, emetophobia is closely tied to anxiety disorders, obsessive-compulsive behaviours, and at times eating disorders. The fear of vomiting may lead some to eat less or avoid eating altogether, which can have serious health consequences. Emotionally, it creates a feedback loop. Fear triggers anxiety, anxiety triggers avoidance, and avoidance reinforces the fear. Over time, this loop can feel impossible to break, trapping individuals in a cycle of fear and restriction. So let's look at attachment styles and trauma. Emetophobia often has roots in complex trauma, including early attachment issues. Those with insecure attachment styles, particularly anxious or disorganised attachments, may be more prone to phobias. If your caregivers were unpredictable, overly critical, or dismissive of your emotional needs, you might have developed a heightened sensitivity to fear and discomfort. This fear also reflects our learned responses to distress. If as a child you were taught either explicitly or implicitly that emotions like fear, anxiety and discomfort are bad or need to be suppressed, you may never have learned healthy ways to process these feelings. Instead, these emotions manifest as phobias or anxieties like emetophobia. So how to overcome emetophobia? Overcoming emetophobia is entirely possible, though it requires patience, persistence, and often professional support. Here are some steps that can help, ideally as part of therapy that includes and is not limited to the following features. Firstly, understanding your fear. The first step is to acknowledge and understand your fear without judgment. Reflect on any past experiences that may have triggered this phobia. Recognise the patterns. Understand your triggers and the cycle of thoughts that lead to your emetophobia. Awareness is the first step toward change. 2. Therapy with a cognitive component. It helps to identify and challenge unhelpful thought patterns that drive the fear of vomiting, replacing them with more balanced thinking patterns. 3. Exposure therapy. Gradual exposure to the feared situations, starting with low-level triggers and slowly working up to more intense situations, can help desensitise the fear response over time. This could be as simple as talking about vomiting, watching videos, or eventually confronting feared situations in real life. 4. Mindfulness and relaxation techniques. Practicing mindfulness can help you stay present and calm when anxiety strikes. Techniques such as deep breathing, progressive muscle relaxation, or guided imagery can help reduce anxiety levels. 5. Addressing underlying trauma. For those with a history of complex trauma or attachment issues, working with a therapist to process these experiences can be transformative. Trauma-based therapies can help reframe past experiences and reduce their impact on our present life. 6. Building emotional resilience. Learning to process and validate our emotions rather than suppressing them can reduce anxiety and fear. Journaling, talking to supportive friends, or engaging in creative expression can help release pent-up emotions. 7. Attachment-focused work. Understanding and healing your attachment style can reduce anxiety and help you develop healthier ways of relating to yourself and others. This is one of the ways in which the therapeutic relationship directly contributes to effective outcome. 8. Other. In work of this kind, it's impossible to know what other related issues might emerge that also need to be addressed as part of a comprehensive package of support. For example, low self-esteem, imposter syndrome, sexual difficulties, and so on. Remember, emetophobia doesn't have to control your life. Understanding the roots of this fear and taking small, consistent steps towards confronting it can lead to significant improvement. Be gentle with yourself and seek professional help if needed. You're not alone in this journey and recovery is possible. Your fear doesn't define you, your courage does. Thank you for watching, and if you found this helpful, please like, share and subscribe for more insights on overcoming phobias and living a healthier, happier life.